young dental graduate from Saveetha Dental College. In the year 2003, she has won 5 gold medals during her undergraduation. In 2012, she was the recipient of the prestigious Best Young Dentist Award instituted by the Tamil Nadu Dr. Menjia Medical University. In 2016, she won the Young Achiever Award instituted by Conservative Dentists and Endodontists Association of Tamil Nadu. In 2021, she was awarded the Diplomat of Indian Board of Endodontics during the 12th IFA World Endodontic Congress. She is passionate about research and her area of interest is Cariology. Her research interests include understanding dental caries dynamics in vulnerable Indian population, caries biofilm models, and biomechanics of dental. She is a member of the European Organization for Caries Research since 2010. She is the first Indian to be elected as an advisory council member of the OCA board in 2022. In 2020, she set up the Department of Cariology at Saveetha Dental College, which is first of its kind in India. Currently, she heads both departments of Conservative Dentistry and Endodontics and Cariology at Saveetha Dental College. I welcome Dr. Krithika Datta ma'am to proceed over the session.
Thank you very much for your kind introduction, Dr. Madana. And good afternoon to all the participants, respected teachers who have joined us today. Without much delay, please allow me to share my screen so that we can go ahead with the presentation. As I said, this is a very different kind of a forum. Thanks to Mahalakshmi ma'am and her team for conjuring this kind of a program, which is in fact challenging for everybody, both for us as speakers and for other people who are listening. I feel that we are all in the process of learning, and today I'm here only to share my experience with a different kind of learning system that I myself got acquainted to in 2020 when I joined Saveetha. I'm here to talk about MILA, which is an exclusive patented learning methodology by Saveetha Dental College. And I was fortunate enough to be a part of this process and also adapt it a little bit to apply it for the subject which I was chosen for, which is Cariology. So as we all know, dental education in India is predominantly governed by the Dental Council of India, which has a fair share of private and government colleges. And there are 8 recognized specialties. But for some reason, we are not yet gone into identifying Cariology as a separate specialty. I think that is because of how the science of Cariology itself has evolved. And maybe in the due course of time, we would also find an opportunity to introduce this as a separate subject in undergraduate curriculum. But currently, we don't have a subject separately for Cariology, or for that matter, oral biology as such. So if you see the structure of DCI regulation, the Dental Council of India advocates teaching or dissemination of this subject of Cariology across 5 different specialties at the undergraduate level. So we all are familiar with this, and this is how the student gets to know about the subject itself. We also know that since different specialties teach Cariology from their point of view, there is no simultaneous connection between the thought process or the teaching process across these specialties. As a result, the undergraduate student is aware of what Cariology means, but is not having a continuity from the pathology or etiology into disease management itself. And this is often administered in the form of lecture classes, which along with a preclinical training or a clinical training, depending on the year the undergraduate student is attending. The assessment of such teaching is usually done through a theory paper and a practical examination across these 5 different specialties. And the university sets aside a minimum pass percentage to allow the student to be proficient in that particular subject. But we don't have this kind of a structure for Cariology subject as yet. Now, what happens when the syllabus is shifted on to the dental college or to a deemed to be university at a university level is that the university has some fair amount of leverage on how they want to deal with the entire curriculum. So the university is expected to conform to the DCR regulations, wherein they have to deliver whatever has been set forth by the Dental Council, but they have the freedom to adopt the method of teaching and learning. How knowledge is disseminated and how students are made to learn these processes is completely dependent on the university level. So this is a very unique opportunity that we all have. And I think this is where our individual involvement in the student comes into place. The university also has the ability to introduce additional subjects as elective subjects, which can enable the student to be aware of whatever is latest happening. For example, a lot of advances are there in aesthetic dentistry that may not be actually covered in the syllabus of the Dental Council, but the university can administer that as an elective course or an elective subject. And the university also reserves the decision to allow a candidate to appear for the exams. So even though the Dental Council has given a framework to work with, it is also allowing a lot of freedom for the universities to function in the manner which they seem best fit. So this is where I think Saveetha Dental College had capitalized several years back in administering the program. Before that, I just want to share with you my journey in Cariology, how it all began. It all began by an accidental tryst with a research paper that I was doing in regards to Cariology. Of course, we have all, as at least my batch and my age group people have all been sensitized in dental caries by Dr. Usha ma'am and Satya sir. There is no denying about it. But in 2010, I was introduced to this board called ORCA. It's the European Organization for Caries Research. And till date, I'm a full member. So we've been attending conferences on a periodic basis and trying to see how the rest of the world is dealing with this particular subject. This intrigued us to work with like-minded people within the country, including Maha ma'am. She is a very much part of the group and sharing both study ideas as well as teaching methods that can be implemented within our ambit. So even before I joined Saveetha Dental College, we were implementing Cariology as a subject in Akshayamal Dental College. So we inculcated IACDE's learning methods in the department for postgraduates since 2015. We've deputed junior faculty members to attend ORCA programs, summer programs in Malaysia. And I've also been fortunate enough to contribute to the dental syllabus revision with regards to Cariology for our specialty. And this happened once in Hyderabad when we all were asked to give our inputs. And also Saveetha has been actively involved with the Dental Council to develop the current syllabus, which I think we should be receiving more directions on that. And very happy to share with all of you that they've been recently elected as the advisory board member of ORCA. This helps us as a country to have a leverage on how to go about changing things, and support from international fraternities like this will definitely help us fasten up the process. What I mean by fasten up the process is we don't have to make our own set of mistakes to find out which is the best method. It better would be to learn from their mistakes and just suit whatever best is for our country and for our students. Saveetha Dental College, you all know, is one of the pioneering dental college, and I'm truly humbled to be a part of this institution. It's ranked #1 in NERF and 18th in the QS World ranking. And to our own surprise, we found that we were listed #1 in the world for research in the QS World ranking. And the reason why Saveetha probably stands apart from what I have seen in my experience is that they would want to do things differently and think differently, which will in the long run help the student and in turn help the profession. So in 2020, the management decided that Cariology should be taught as a separate subject, both at undergraduate and at postgraduate level. And I was fortunate enough to join Saveetha as the head and start this department, because this has been my dream all through. And when somebody offered it, it was like dream come true for me. And this is probably the only institution in India which has had the head start with developing Cariology as a curriculum for dental graduates. Just a brief on Saveetha Dental College. It is a massive institution with about 800 dental operator units and six international theaters, operating theaters. A very unique feature that I found useful for both teachers as well as students is the use of a online patient management software, which is called as DIAS. Now, once things are fed into the software, it is there for us to go back and refer, both for education purpose as well as research purpose. So this is, I feel, is a very useful and significant asset of the dental college. There are about 1,700 patients a day. So the student gets to learn a lot through patient problems and patient management. And of course, as I said, the focus is very heavy on research in Saveetha. And we are probably ranked number 2 in Scopus next to Harvard. It's a matter of real pride. And these are the number of publications in 2022 alone from the dental college. And I'm just happy to share the cumulative impact factor for the year 2022, both in Scopus and of Web of Science. When the intention is to push towards research, it is also in an idea that it is an additional method of learning. So when you are indulged in research, you cannot perform or you can't move forward with the research work unless you learn that particular problem and try to solve that problem. So everything is student-centric and patient-centric, so that the fraternity itself is seen as something precious among other competing specialties that we have. Now, when moving on to the teaching learning methods in Saveetha, as I said, there are 3 forms of teaching. One is the theory, which is entirely module-based. I'll explain what this module-based of teaching is. Second is learning in the clinical aspect. So the learning entirely is problem-based learning. So here, the students don't rotate between departments. They don't go for conservative posting for 15 days, followed by prosto posting. Instead, the students are all divided into 6 different clinics. We follow the clinic system. So they divided into 6 clinics. Staff members from each department are posted in each of these clinics, and a patient is allotted to one particular clinic. So the patient walks in, it's like how you walk into a dental clinic. So once the student takes up a patient, he tries to solve all the problems that is possible within his permit to help the patient, and whatever is beyond his expertise gets referred to the specialty departments. So in the process of learning what the problem is and solving the problem, he also gets to learn dentistry itself holistically and not just focus on quota or the subject that which they are inclined to learn. And thirdly, as I said, short-term research projects, which helps in solving gaps in knowledge. These are all very simple questions they are expected to ask. It's something that will help them think. So when a person thinks, they find solutions on their own. So we actually find that the undergraduate students in Saveetha adapt much better than the postgraduate students because they are fresh, they are not having preformed ideas about what dental education is, and they are much more savvier to adopt whatever is provided for them. But when it comes to postgraduate teaching, it is quite a challenge because we have students who have already learned things from different colleges, their different teaching patterns. So there is a process of unlearning and relearning. Moving on to this module-based learning, which is the primary focus of today's lecture. What we have in Saveetha is a structured module for all postgraduates. I'm just sharing a screenshot of how their syllabus is provided at the beginning of their postgraduate curriculum. So this provides every student is given an Excel sheet like this to show what is the timetable for his specialty and across other specialties as to what they will be doing in the next 3 years. So their roadmap is already charted. So if you're joining in 2022, they know what they have to do until 2025. So there is no excuses both for the staff member or for the student to say that we were not aware of it. And in these 3 years, what happens is leaving the last 6 months, the remaining of 2.5 years is split into 10 modules. And each of the module focuses on the particular part of their specialty. Say, for example, when I did my post-graduation, we were doing 3 months of preclinical, and then we would enter clinicals. We would have periodic seminars and journal clubs. But what I felt was happening in that method is we used to focus on whatever was the forte of the teachers present in that department, but not focus on certain things. So if I can share an example, we all know that students from Karnataka are very strong when it comes to inlay cavity preparation and indirect casting methods. But I don't think that I learned so much as a postgraduate student when it comes to indirect restorations. So this kind of unlevelness is not possible with this module system because each subject is covered in 3 months. Say, for example, if you have basic endodontics, that will be covered in 3 months. Cariology, that will be covered in 3 months. So both for the student and the faculty member, we are forced to be up to date in whatever is needed for that particular specialization. And when it comes to Cariology, you can see that the one marked with light across 4 specialties, you will see this Cariology marked, which means that all 4 specialties will go through that particular module. So they all come to the Department of Cariology to learn Cariologies. And the 4 involved specialties are ours, public health dentistry, oral pathology, and pediatric dentistry, because this is where they predominantly learn and manage the disease of dental caries. Now they come, so there is no possibility of skipping timetables here because everything goes on track. If even one department lapses in finishing their previous module, then it will interfere with the next module, which is integrated. So all similar colors across the chart that you see are integrated modules, which means more than one department is collaborating in teaching the subject. Now, what is involved in this module-based learning is it is basically for 3 months. Weekly, they have 2 theory classes starting from 8 o'clock to 3 o'clock. And there is an intense learning engagement through the system of MILA, which I will be explaining. There is continuous assessment throughout the module. So there are, when we say assessment, it is not technically test. The assessment can be in any form. It could be just asking them to talk on a subject and see how well they are able to articulate, or then have a debate between 2 groups and see how each of them are putting forth the points. So assessment is continuous process. At least we'll have about 10 assessments in the 3 months period, which will be taken up for their marks for their internal assessment for that particular module. And then we also have a theoretical and a practical assessment at the end of 3 months. So this is how typically any module would take place in Saveetha Dental College. And when it comes to Cariology, if it is an integrated module. When we say activity, when we say the learning takes place on 2 days for around 8 hours, everybody usually who visit the college and learn about this, how can you teach some subject for about 8 hours, like starting from 8 o'clock to 3 o'clock? That is where the entire concept of teaching learning method comes. And this kind of a format is necessary because when they are engaged on a one-on-one basis with the course coordinator, then the interaction itself is beautiful and the learning becomes on a totally different scale. So what is this MILA? MILA stands for Multiple Interactive Learning Algorithm. So as you can see, it is not just a discourse. We don't take, in fact, we are forbidden from taking any classes on PowerPoint. We don't take lecture classes at all. Neither does the student present it in a form of a seminar. But there is more of interaction between what we have to say and what they have to say. And learning takes place through that method. And this is not just one-on-one dialogue. There are multiple methods by which this can be instituted, and I shall explain that. Why this method was devised and thought of and patented in Saveetha is because the nature of the human brain, it's constantly evolving. If we recollected from our ancestors, typically the Vedas, they used to learn Veda only by listening to what the master used to say. So their capacity to absorb and assimilate just by hearing used to be extremely powerful. That was because the brain was extremely evolved, and that's what used to happen at the Gurukulam based of learning. But as evolution has occurred, what science has found through research is that the attention span of the human brain is dwindling. So in 2000, the attention span averaged around 12 seconds. But in 2013, it's shrunk by 4 seconds. So it's only 8 seconds. And now you can see that our attention span is actually less than that of a goldfish, which is known for its, absent-mindedness. So the brain is not able to process the way it used to. There is a lot of evolutionary processes that is taking place. Why that is happening, that's a totally different debate, but it is happening. So with the evolution of brain and the diminishing attention span, I think we need to adopt different teaching methods, because the pedagogical method or a totally academic theoretical discourse is not going to suit the current generation students. So what the human brain is currently conducive is, again, according to science, is they are extremely focused in the first 20 minutes of whatever they are listening. So that is taken into consideration while MILA was devised. And the traditional versus MILA based learning method, traditionally we used to have 1 hour lecture classes, either for UG or for post-graduation. They usually take an hour of seminar, but this has been replaced by a 2 hour learning time. It is not teaching time or theoretical time, but it is a 2 hour learning time. What happens in these 2 hours is you teach something for 20 minutes, then you teach something for 18 minutes, quickly discuss it for 2 minutes and summarize that whatever they have you have taught. Give an activity for the next 20 minutes and make sure that they indulge in activity. While they are practically engaged in that activity, they kind of recollect whatever has been taught and apply it on their own side. It's not like they have just listened to you and have assimilated, but they apply it on that particular activity, try to solve that activity with whatever they've learned in the last 20 minutes, which helps them to regain whatever has been taught. Again, you follow it up with a 20-minute teaching of the next concept. 20-minute activity, 20-minute teaching, 20-minute activity. So this is a 2 hour learning time that is done on a set thing. Then you have a 15-minute break, or you break for lunch. So this is the way the entire 8 to 3 is actually split. So when you're indulging in activity, it reiterates and reinforces whatever has been taught in 20 minutes. Now, as a teacher, for us, the challenge is, if we are going to talk about intracanal medicaments as a subject, we can't talk it out all in 20 minutes. We probably talk about calcium hydroxide in the first 20 minutes, give them an activity which is based on calcium hydroxide, then go on to talking about triple antibiotic paste, give an activity on triple antibiotic paste. So that's how we segment this entire topic of intracanal medicament. So it is a challenge for teachers also. In fact, we also have to do a lot more work than just prepare the subject. So we need to also plan activities accordingly. But it will be when I was initially asked to deliver something like this, I was wondering how I would manage it. But then it was a real fun because they also have a structure of activities that you can choose on. So the type of activity that you can select can be from any one of these 9 methods. So it's not like these are also established methods when it comes to activity-based learning. They are also proven methods that reinforces learning. Let's see this one-on-one. What is scale up? Scale up is study-centric activity learning environment. Here, after you talk about this, so when I say we have applied this for PG integrated curriculum, we have about 21 students across 4 departments. So it's just a small group, but they are further divided into smaller groups of maybe 5 students in each group. And they focus on some activity pertaining to that particular thing. What happens when you are breaking them is you move around table. Each group will have different questions. So you try to solve their questions then and there, and then it becomes much more easier for them to even communicate with us. We've often seen that after you finish your class, you ask if you have any doubts, you can ask. Nobody actually speaks up. But then when you give something to them, make them into a smaller groups, and they are now at the onus to solve that particular activity, they kind of come back and asking, but this is not like this, what do we do? So then there is learning happening at a much easier scale. So this is scale up method of activity. Next is process oriented guided inquiry learning. So guiding the search for solutions to questions. This happens alongside with the scale up, is that when they ask you something, then you guide their thought process in a particular direction. You don't give the answers actually. So you guide them in a particular way, and then they think in that line and they come back, ultimately with the answers. So this is a one-on-one interaction design. Typically, probably it's the same thing like what we do to teach a toddler or a primary school kid. So we keep asking questions. So what do you do next? What do you do next? So that's how it builds up. So this particular method is found to be extremely predictable. It can be perceived beforehand. You can know what direction they are leading into, and then you can guide them in the right direction. There is a feedback mechanism also. So they tell you that, no, ma'am, but this is what we thought would happen. And then you can help them correct that. It is consistent because it is happening on one-on-one basis, and it is easily learnable and doable. So this is the interaction design that helps when you're in smaller groups, which is called process-oriented guided inquiry learning. Next form of activity is called concept mapping or mind maps. So I was actually surprised when I came to know about this form of learning, but it is what we have all been doing as undergraduate students or postgraduate students. At least I remember making notes and putting branches on the side and making sub notes of the notes to recollect whatever we've learned. So that's the same thing expressed in a cleaner, neater format. It's called as a concept mapping. So if you give it, if you've spoken about micro-invasive techniques, so you make the student write out whatever they've remember from what you spoke in the last 20 minutes. So that will help them to reiterate in their mind when you write it out or when you type it out. Like there are softwares for this. So when you type it out like this, you kind of recollect what was taught, and it is a reinforcement in itself. And this can also be actually useful for their revision for their module exams or for their university exams. In fact, this mind map or concept mapping is followed both for the undergraduation and the post-graduation curriculum. Next is a jigsaw-based task or activity where you divide them into small groups. You give them different topics to discuss and talk. Say, for example, you have finished entire thing on intracanal medicaments. You give one medicament to each of these 4 groups. ask them to learn more about it, either through looking up PubMed or through going through their textbooks. And one student from each of this group gets shifted to the other group. So student number 1 from group 1 will go to group 2. One student from group 2 will go to group 3. Another student from group 3 will go to group 4, and group 4 will go to group 1. And they will talk about what they have learned in their particular group. And they go around in circle, whereby all the groups get to learn about all the components of intracanal medicament. So here, the teaching is entirely left to students, but it is also monitored by coordinators. So each of these desks will have coordinators, seeing if the discussion is going in the right direction. So this is jigsaw-based activity. Then game-based learning. So this is an interactive kind of thing. Here you can have a debate, or sometimes even dumb charades or Pictionary. So any activity that is game-based is pretty fun to think, and they remember the fun part of learning, and hence the subject is reiterated. This particular picture I have put here because even during lockdown, we were expected to teach only through the MILA method. We were not asked to make PowerPoints and just share PowerPoints. Even during lockdowns, they asked us to follow the MILA method of teaching. So this was just one fun activity that I gave them to go, and whoever brings the top 5 people who bring the most Cariogenic food, and the least Cariogenic food, they just need to keep it on a table, click a picture, and post it in the WhatsApp group that we have. So they ran, they brought whatever was there, and then they clicked a picture. And then you start on asking which is Cariogenic. So they say maida is Cariogenic, dairy milk, sugar. But then few students told that paneer is Cariogenic. And then discussion went on into that direction. Why is paneer Cariogenic? Because we see cheese or paneer put on pizzas, and usually pizzas is considered as junk food. Then you have more discussion into it. So the junk food of pizza is not because of the cheese, but it is because of the base. Then through this discussion, they learn to differentiate between what is healthy, what is unhealthy with regards to dental caries. So this way of interactive games to teach specific concept was very, very useful. And it's actually fun for us also. It lightens up the mood for some time. So this is something that we do quite often. But the serious learning also takes place at a postgraduate level, because at postgraduate level, evidence-based practice is emphasized beyond, and they have to know what is the current evidence in the form of systematic review. So there is critical pedagogy section where they critique and detect errors in faulty reports. Now, when we all have been doing this, in fact, even I have done this as a postgraduate student, which we call as journal club discussions. But for critical pedagogy in our college, what we do is to critically appraise only systematic reviews. And when we say critically appraise systematic reviews, all systematic reviews are appraised against AMSTA 2 guidelines, so that they follow a structure on seeing which evidence is reliable, which evidence is not reliable. After they do this exercise, each of them presents their point of view. It's more like giving their opinion on the topics that they have studied, rather than talking whether what was right and what was wrong. So it's more like giving a movie review about a particular systematic review. So sometimes some students agree and some students disagree. Then again, there is a debate or a discussion as to why they agree or disagree. And then concepts gets reiterated. But for postgraduate students, critical pedagogy is compulsory. Next is peer-led team-based learning. So one student is nominated from a team to lead the team to complete a learning objective. So they learn and they teach. So when they teach, they also learn how to communicate, how to make concepts clear, and also brings in some kind of leadership values into them. So this is also helpful for when, and also when they learn from their own peers, it's much more easier for the students to follow rather than listening to a professor or staff member as such, because they fun around, they pull the leg, and then this person tries to say that, no, this is how it is. So that way it is quite interactive. And finally is the flipped classes. I think this a lot of us would also be aware. As the name suggests, flipped classes is in a regular class, the student is taught in the class and they revise at home. In flipped classes, what happens is you give them a topic, they learn that at home and come and revise at the class. So flipped classes helps them to read it in the way they have understood it. And when they come and discuss it, they might discuss it right or they might discuss it wrong, but then at least their thought process gets corrected. So flipped classes works very well for systematic reviews or appraising systematic reviews, or for broader topics that needs to be discussed. So you save time about talking about that concept in class, rather just have discussion on the topic. Now, based on this, we have theoretical assessment, which is long answers and then short answers, which is again according to the DCA format. But what they write for a long answer is totally different. They write about systematic reviews of that particular topic. So for example, if their essay is on micro-invasive techniques to manage dental caries, then they have to write about all the systematic reviews that had described micro-invasive technique and tell their inference in the end. So this is actually, it sounds very difficult, but this is what they've been doing all the 3 months. So they've been reading systematic reviews, appraising them, giving their point of view, and also they do write tests on these. So, and it's only for a particular subject, it's only for Cariology alone. And short answers is again not in a descriptive format. They just have to draw a mind map or a concept map for the topic that is being given. So if they say sodium hypochlorite, you just have to draw branches and say what it is, where it is implicated, mechanism of action, adverse reaction. So they just create a mind map and submit it, and assessment is done on that. Now, the advantage of this is you don't have to rely too much on the way you present the subject. So it doesn't have to have an intro, body, and a conclusion. You just present whatever you recollect of the subject. But the flip side is, if you didn't prepare for that particular topic, you will not know what to write. So you cannot beat around the bush. And finally, there are 51 mark questions, which is in the form of fill in the blanks and not choose the best answer. Because in choose the best answer, by fluke, you might hit the right answer. But when it is fill up the blanks or 1 mark question, 1 word answer, if you know the answer, you will write. If you didn't know, you will not be able to answer that particular question. So this is the theoretical assessment part. And practical assessment part takes place through case discussion and treatment planning. So they take up a case. If in a Cariology module for PG curriculum, they have to discuss the risk factors, like a typical OSCE method of assessment, and then also perform a particular treatment or an exercise. This is left to their individual departments which they deal. So for oral pathology, there is no clinical component. So they do exercises on ground section, but we do deep caries management, pediatric dentistry does crowns. So that is also assessed. And then they have a viva, which conforms again to the dental council. Now, all of this will be assessed at the end of 3 months as a university exam. The module ends with a university exam for that particular module. So the Cariology integrated module has a university exam wherein you call an external examiner to mandate the exam. It's not done internally. So the results are fair and square. In fact, again, all the marks are entered by the external and published the same day. So this allows a complete transparency of the system. And we're very happy to share that the students performed well in this kind of an integrated module. In fact, in 2021 was the first time that all postgraduate students went through this kind of an integrated module. And 2022, the results were much better because even I learned I was better in administering the module, wherein I was trying to figure out how to do it in 2021, but 2022, I was a little bit more clear. So I think that probably helped the students to score more marks. And this is all assessed by an external examiner and it's not internal at all. So my concluding remarks regarding MILA is an effective teaching learning method. It's not a teaching method, it's a teaching learning method. It is simple and applicable both at the undergraduate level and the postgraduate level. And such integrated modules for Cariology is necessary in India, especially when we are talking in post-graduation, to assemble all concepts that they have learned in their undergraduation. It will allow both vertical and horizontal integration that was done in their UG curriculum. So with that, I really take this opportunity to thank the entire team of SRM Dental College Ramapuram and Mahalakshmi ma'am and Rajkumar sir for this wonderful program. Of course, Saveetha Dental College for always pioneering. Though we work there, we are also amazed at how Dr. Deepak can conceive and do these things effortlessly. And my sincere acknowledgements to friends from Orca who have been constantly encouraging me, helping me develop the curriculum, and helping me with any kind of troubleshooting from time to time. Of course, my dear family from Meenakshi Ammal Dental College, because my journey in Cariology started with all of them. Without their support, I don't think I would have pursued something as abstract as Cariology. And I'm very happy to be working with beautiful people in Saveetha Dental College who make my day, every day count and my life memorable. Thank you one and all for your patient listening.
Dr. Murli, can you please take over?
Yeah. Anyway, they say like everybody so good, and I don't know, I'm jealous of Chennai. Everybody is in Chennai. Not one is in Bangalore, like a little of Chennai connection. And as they say, they great people don't do different things. You do really things differently, ma'am and Krithika. That much I can say. It was beautiful, even though I could join last. I can really appreciate the way how you can make dentistry interesting and informative and very relevant. That is not no. So Cariology, otherwise, if not for Krithika, I won't study Cariology 100%. I'll feel the same thing. I won't even. I mean, let me be very frank. Thank you, ma'am. Sorry for the glitch again. Sorry for a loss of 15 minutes. Anyway, as you told me, I can moderate the questions. If anything is there, I think it will come on the chat box. I'll open the chat box.
Actually, there are no questions. Everybody is writing that you are so good with such varieties of teaching and learning experiences.
Yeah,
Somebody says absolutely fantastic. I think everybody loved Krithika's lecture.
No, ma'am. Definitely, ma'am. How to say it? Like, I never knew. I mean, they are doing something, but how they are doing? So she explained so nicely.
Yeah.
And that, I mean,
now I
yeah,
think
that
everybody
reaches more people. Yeah.
Everybody like a cow, they're trying to assimilate what Krithika has given now. So it will take some time. Maybe we can have a few questions during the
definitely, ma'am.
6 days.
No.
By the time we ask all the participants to please send in your questions to the email ID that has been put in your link. So you can please send it to that, and we will take it up then. And thank you so much, Krithika, for that wonderful lecture. Congrats on becoming part of the advisory board of Orca. I know how difficult Europeans are, such a closed community, and allowing you to be part of it, that means you have really done a good job.
Thank you, ma'am.
And thank you, Dr. Murli. I know from
sorry for the glitch. I didn't know what happened.
From 11:45, poor fellow has been trying to log in, and he
no. 11:45 I tried. Because you had sent a message by 11:15.
Because we're getting late, we had to start.
Absolutely no problem. Better late than never.
Thank you so much for moderating.
Krithika, thank you again. Krithika, you can really, if the things permit, you can add more people to your group and train also exclusively on this, how to go about it, so that like they say, you cannot be everywhere physically every time. So at least we'll pass on the message with your reference and with your due credits to you. It will be very nice, Krithika. And definitely, I think you will do along with Dr. Mahalakshmi ma'am and all that. Thank you, Krithika. So nice it was. Oh, I did not miss really much. I could manage.
Yes,
Thank
the
you.
initial part was more introductory, but I think you were there for the main.
Illa, that's what. No. I mean, actually,
And
I didn't know
also
what
to inform all of you, all the recordings of all the lectures will be available soon. So those who
Yeah,
have missed it and those who want to revisit it can do so. I will definitely revisit all the lectures till now at least. So I will just go. I am getting old, so I'll take little time to assimilate and understand it.
Just to add, in fact, we had a
Hopefully
college
the younger
visit.
generation will take up these type of
Sure.
teaching. I know now because it's difficult to keep, as she said, now I understood why, because the attention span is becoming lower, much lower now. That's the reason they are not able to, sit for long to listen and to grasp.
No, this was perfectly all right time, and I was fortunate enough to join Krithika and her PG students for a critical appraisal for a journal club. When I went for a college, I went early, so 1 hour I could spend a lot of time, and it was in fact again on Caries only. It was so nice, ma'am. Krithika, thanks for that day. I remember, I don't forget this. Thanks for permitting to be there with you. Thank you, Krithika. God bless.
It's so overwhelmed, ma'am.
Thank you, ma'am. Thank you, ma'am. Thank you.
Over to you, Vidya, to continue.
And
Yes,
thanks,
ma'am.
Vidya. Thanks, Vidya, for sharing the struggle with me. And
Thank you, sir. Thank you, sir. We truly appreciate, sir, your untiring efforts to join us. Thank you, sir.
Thank you. Thank you. Thank you, ma. I never tried to.
Thank you, Krithika. That was wonderful.